Good day, everyone. I am Christine, the moderator for this webinar. I welcome everyone to today's webinar, that is 2026 Updates and Best Practices for CCM and RPM. I would like to introduce our presenter for today, Dr. Irina Goifman. Dr. Goifman is a nurse practitioner and a doctor of nursing practice with 25 years of nursing and 15 years of executive experience. Dr. Goifman is a subject matter expert in chronic care management, remote patients monitoring, and care coordination, making her a frequent presenter at multiple conferences. I would now like to hand over the floor to the speaker. Over to you, Irina.
Hi, thank you. Welcome, everybody. I will talk today about 2026 Medicare proposed updates, but I know name said CCM and RPM, but I will give you a lot more. Today, we'll talk about what's coming for 2026. We'll discuss the conversion factors, what's new in RPM and RTM space, what is the difference between AMA and CMS view on CPT codes. We'll discuss changes to virtual direct supervision, some updates to federally qualified healthcare centers and rural health clinics, the APCM add-on codes, and change to digital mental health treatment. And of course, as always, we'll talk about RPM and CCM compliance and best practices, because that is what I love to talk about. Very quickly, just on the history of the rulemaking, but also even if it's finalized, it will take place on January 1st, 2026. So be ready, but do not make any practical changes to what you're doing yet. This is the first time in many years that we have a great news on conversion factors. And this year, they're doing something very different. They're proposing 2 different conversion factors. Now, the good news or the bad news is that Medicare proposed no changes to anything that has to do with chronic care management or principal care management. So here are the proposed changes that are coming to us in 2026. In terms of virtual direct supervision, so remember that, remote physiological monitoring, or what colloquially people say remote patient monitoring, 2 amazing changes that are coming out in 2026. Second amazing change, and this is the table with approximate reimbursement. Remote therapeutic monitoring mimicked pretty much what RPM proposed, what CMS is proposing for RPM, and it's happening in 2026 as well. They're not changing it. So best practices. CCM, they have not added RPM, and I think that's an amazing addition to the repertoire of unbundling the services and actually doing CCM, RPM, BHI, RTM, and everything separately. So that's a huge thing for them. Advanced primary care management, and it was really designed last year. It was a huge huge step from Medicare, and they approved 3 codes last year. And these are the codes. Again, it's initial psychiatric collaborative care management. 1 big change to digital mental health treatment. And let's talk about best practices. I would highly recommend having a compliance assessment. You want to make sure that you're staying up to date, informed in what's happening and what's changing. Can CCM be provided by physician or nurse or non-physician provider who are nurse practitioners or physician assistants or staff located outside of the United States? And I can tell you the answer is no. To bill 99490, which is 20 minutes of care management in CCM without a conversation with the patient? And the answer is surprisingly yes. Can CCM services be completely delegated to clinical staff? But Medicare is saying no, because the billing practitioner must retain a certain level of involvement in CCM. And with that, I want to thank you. Thank you very much. Wonderful questions. Reach out to me, look at the website, see what you can find interesting, and good luck, and let's make this work. And I think that's a wonderful space to be in right now, where patients get tremendous value from it being done correctly, and providers get great clinical and financial benefits. So thanks again for coming.
Thank you, Irina. That concludes the session for today. Thank you everyone for participating. You may all disconnect now and have a great day.
Thanks.